Welcome to CCIA's webinar, our second of the day. We are partnering for this webinar with the Department of Public Health. We have an exciting webinar planned. We're going to walk through a PowerPoint presentation, and then we will have about 30 minutes towards the end to answer hopefully all of your questions. You can use the sidebar in the GoToWebinar to type in your questions. Everyone will be muted for the duration of the webinar, so if you have any questions, please feel free to go ahead and use that chat app on the GoToWebinar control panel. So we're going to wait just one more minute as we get ready and before I introduce my guest. So for those of you just joining, we're going to ask folks if you have questions to please go ahead and plan to write them out in the sidebar of the GoToWebinar panel. We'll try to get through as many as we can today. Welcome to the webinar. Thank you so much, everyone, for joining us. This is our second one of the day, and we are very excited to have the most distinguished guest. Miren Klein is the Assistant Deputy Director of the Center for Environmental Health, and one of their programs is the Manufactured Cannabis and Safety Branch. So she will be diving into emergency regulations for cannabis manufacturing. For those of you who I haven't met, my name is Lindsay Robinson. I'm the Executive Director of the California Cannabis Industry Association. We're very excited to have all of you with us today. I just want to give a special thanks to 9 Point Strategies for helping us produce this webinar. We would be lost without all of you. Thank you so much. I also want to thank Josh Drayton, our Communication and Outreach Director, for helping to organize all of these, and Justin McCarthy, who is our Membership Manager. So let's dive in. Miren, thank you so much for spending an hour with us today. We're really pleased that you're here.
Well, thank you, Lindsay. Thank you very much for having us. I think it's wonderful that you give us this opportunity to be able to reach out to even more industry folks and provide an overview over the regulations that we released not too long ago. These are the emergency regulations for manufactured cannabis businesses. So I am going.
Oh, that's perfect. I got it. Good.
So I'm going to just do a quick overview, some background. I think it's always important to kind of do a refresher as to you know, who is involved, who we are, and how do we get here. So of course there's 3 departments that are doing licensing, and that's a little bit different from what some other states are doing, because other states usually have one entity issuing all the licenses, but California decided to go a different path. So you have the Department of Food and Ag that is going to be licensing the cultivators. And then on the other side, you have the Bureau of Cannabis Control, and they're licensing the retailers, the distributors, the testing laboratories, and the micro businesses. And so we are public health, and what I'd like to say is that we are in the middle of the supply chain. And we are going to be licensing and regulating cannabis manufacturers. So who is a manufacturer? Well, manufacturer is it's a business that is conducting extraction and infusion processes, packaging and labeling of cannabis products. And when a plant material has been transformed into a concentrate, into an edible, a topical, or other product containing cannabis. So that's defined as manufacturing. So quickly, let me recap how we all got here, because I have to tell you, being from public health, I'm not sure if I envisioned I was going to be involved with the cannabis program.
I can understand that.
Yes. So I think most of you likely know medical marijuana has been legal in California for more than 20 years under the Compassionate Use Act. And then in 2015, the governor did sign a series of bills, and those created the first regulatory structure for medical cannabis commercial market. Well, then we can't forget November 2016 and Prop 64. So that was approved by the voters. So that legalized the adult use or the recreational commercial cannabis market. So then, in 2017, the legislature approved what's being called the Medicinal and Adult Use Cannabis Regulation and Safety Act, or MAUCRSA for short. It's quite a mouthful to say.
Yeah, it is.
So that came through Senate Bill 94, and what that accomplished was it combined the statutes for medical and the Prop 64 adult use into one regulatory framework, one regulatory scheme, and actually that provides us better coordination, and now we are able to develop regulations for one set of statutes only. So what are the principles of MAUCRSA, or the Medical and Adult Use Cannabis Regulatory Safety Act? So it identifies the public health and product safety as its highest priority. Also created a very specific definition for cannabis products. And this is important for us, especially in public health and for cannabis manufacturers. Because in public health, we also regulate food and drug manufacturers. So what this statute created was a very different definition for cannabis products from what's currently in statute for food and drug. But in our regulations, as I will talk about later, you will see that we borrowed many of the principles from food and drug manufacturing. Third, it allows for vertical integration. I think probably most people know that. You can hold multiple licenses, multiple types, and there is one exception, and that's, of course, the testing laboratories. And then finally, it established the dual licensing system. So this is between the local health jurisdiction and the state. For the state to be able to issue a license, the locals first either have to issue a permit, authorization, or they have to have an ordinance approving this activity, or when we reach out to the locals, they have to say that, yes, we can move forward with licensing the business in their jurisdiction. So the dual licensing structure sets up, so the state, I'll talk a little bit about from the state side what that means, and then I'll move over to the local side. From the state side, so our regulations that Department of Public Health has issued, these are the basic requirements. So these are the minimum requirements that all of the businesses must follow. The statute does allow a local jurisdiction to set stricter statutes. They cannot set a regulation or a statute that is less stringent than the state, but they can go more stringent, or they can just borrow what the state does, and then it's the same. Beginning in January 1, which is coming up a lot sooner than...
Right around the corner.
It's right around the corner. Yep. So January 1, all cannabis businesses must be conducted between licensees. So state regulations. I think probably most of you know we released, all three of us, so it was Food and Ag, the Bureau, and ourselves, we released the emergency regulations for the public on November 16th. And the emergency regulations actually became effective. There's a process that we have to go through. So those became effective last Thursday, December 7th. So now we do have emergency regulations in place, which means that, in essence, we also are open for business. Mm-hmm. And the emergency regulations, what they include are requirements that are needed for the state to begin issuing licenses. So a couple of things that I want to point out about the emergency regulations. These are temporary because they're emergency. They're good for 180 days, and then we can actually renew them once. So in essence, they are good until December of 2018. So in the meantime, again, right around the corner, beginning probably in the first few months of the year, we will have to issue another package of regulations that those are going to become our permanent regulations. So I just want to mention that for everybody to know that when we issue those regulations will go through the normal rulemaking process, very similar to what we did back in April when we released the first set of medical regulations at that time. So we will do a 45-day comment, we will address all the comments, and we have then until December to finish that the permanent regulation package before the emergency regulations expire. The way we're going to communicate all this to industry is our website and our listserv. I'll give those resources later on. I have a slide at the end. So if you're not signed up for our listserv, and you can do that through our website, I definitely encourage all of you to do that. It's one of the main methods that we use to communicate information out to the industry. Okay, so the California Department of Public Health, of course, our main goal is to protect the public health and product safety. And we have two main tasks that are associated with that. So first is to make sure that the cannabis products are manufactured in a clean and safe environment. And second, that they are packaged in a way that informs the consumer about what they are consuming and also minimizes unintentional consumption by children as well as adults, especially novice adults. So the license categories and types that the Department of Public Health is going to be issuing, and some of this is probably going to be very similar to what the other licensing agencies are doing. So we're all going to issue separate licenses for the M and the A. So if you're going to manufacture products for the medicinal market, then you need an M license. If you're going to manufacture products for the adult use market, you need an A license. You can have both an M and an A. That's quite a mouthful. You can have both of those on the same premise. Then we get into the type of license that a manufacturer can hold. And you only need to hold one type, even though on the slide there are 4 types. And the type is determined by the activity that you are doing. So if you are doing volatile solvent extraction, then that's a type 7. So that's the type of license that you would receive from us. But that license type would also allow you to do non-volatile extraction and infused products and packaging and labeling. So with a 7, you can do pretty much everything below that. A type 6, that's for mechanical and non-volatile solvent extractions. And if you get a 6, you can also do product infusions. You can also do packaging and labeling. If you, so everything below the 6. So if you do no extractions at all, we created a type N. And we actually created this type when we did stakeholder meetings throughout the state. It seems like it was a long, long time ago, but not that long ago.
It's been a long year.
It's been a long year. We actually heard from businesses. Some of them didn't want to be classified as a 6 because they were not doing any extractions. So we created a new license for those businesses that are only doing infusions and then packaging and labeling of their own product. And then the last type is type P, of course, for packaging and labeling. And this one also came out as a result of stakeholder feedback that we received, where some businesses want to be able to just purchase the products and they do all the packaging and labeling. Well, packaging and labeling, packaging especially, there's critical control points, contamination points, so that's considered manufacturing. So we created a license type for that as well. I want to mention that there is another type of license that we are currently creating. The requirements for that license type are not in this emergency package. We are very shortly, probably at the beginning of the year, we're going to be releasing a second emergency package, and it's going to be for a type S, which is a shared facility manufacturing license type. What that will allow, because again, through stakeholder feedback and feedback that we received from some local jurisdictions, is it could be, capital-wise, it could be very expensive to do some of the manufacturing, some of the infused products. So with a shared facility, multiple licensees can then use the same shared facility, and then we will license all those individuals independently. So that's coming up shortly. Another good reason why, sign up for our listserv, because when we release that package, that's how we will communicate that. Let's see. Okay. So operational requirements. I hope all of you have read our regulations in detail, because there's extensive information in there about good manufacturing practices. So what do we mean by good manufacturing practices? So I'm going to touch at a very high level, but please do refer to the regulations, and if people have any questions after reading the regulations, again, at the end of the presentation, I'll have a slide with our email address, so people can reach out and they can ask questions for it to us. So good manufacturing practices, and this is really, we borrowed this from the food and drug industry. So it's sanitary operation procedures for the facility as well as for the equipment. Procedures to protect against allergen and cross-contamination of cannabis products. Cannabis products must be free of contaminants, so that includes everything from pesticides to mold and bacteria. And then the THC levels have to be consistent throughout the product to ensure that consumers know what amount of THC they are getting with each serving. Volatile solvent and CO2 extraction, that must be performed on a certified closed-loop extraction system. And the closed-loop system in the facility must be approved by use by local fire code official and meet all fire, safety, and building code requirements. And lastly, cannot conduct volatile solvent extraction operations in an area zoned as residential. So these are just very high level, but please do read the details in the regulations. So cannabis product standards. Again, we're not trying to be party poopers, but there's standards that we have to follow. Some of these come from statute, others come from just our knowledge of the food industry. So alcoholic beverages cannot be infused with cannabis. Now, let me just clarify that this does not apply to tinctures. I know that was a question that we received when we first issued the medical regulations. Prohibitive additives, so those include nicotine and added caffeine. And what we mean by added caffeine, it's really you're adding extra caffeine. So that restriction does not apply to a product that contains caffeine naturally, like tea, coffee, chocolate. You will still be able to use those products and infuse those with cannabis. No perishable products. So these are products that must be held at or below 41 degrees Fahrenheit to keep safe for human consumption, such as dairy products, meats, and seafoods. But let me clarify a few exemptions here. This applies to the final product and not to ingredients that are used in the recipe of the product. And then there is two exceptions to this rule. So one exception is if you purchase butter from a licensed milk products plant, then you can infuse the butter with cannabis. You just cannot make your own butter. And the other exception is beverages and juices. Those, if they need refrigeration, they can have refrigeration as long as you follow all of the procedures and requirements that we have in the regulation, which includes health hazard analysis, critical points, and there is a number of items in regs that have to be followed if you're going to be producing a juice that needs refrigeration. Because the juices are breeding grounds for bacteria. So we want to be very careful on how those are prepared to ensure that the product has to then maintain refrigeration throughout the whole distribution chain as well.
Mm-hmm.
Next is no low acid canned products. And the reason for this is because of the risk for botulism. And then lastly, a cannabis product cannot be in the shape of a human being, an animal, an insect, or a fruit. So THC requirements for cannabis products. So let me tackle the edibles first. For the edible products, the product is limited to a maximum of 10 milligrams per serving of THC and a maximum of 100 up to 100 milligrams of THC per package. And this requirement applies to both the medicinal market and the adult use market. And one of our main rationales for this is because edibles are the ones that have the highest potential for children to get into, as well as adults to like eat the whole chocolate bar instead of the one serving. So a high probability of unintentional use with the edibles. For the other products, so these are products like tinctures, concentrates, capsules, and topicals. For the adult use market, we do not have a per serving cap, but we do have a total package cap of 1,000 milligrams. And for the medicinal market, a total maximum cap of 2,000 milligrams per package. So the only difference that we made, because we did release these THC limits back in April when we released the medicinal regs, and we did receive quite a bit of feedback to have a different limit for the medicinal market. So we accommodated that by providing a higher limit. That is mine. A higher limit for the other products. Great. Okay, so packaging. Again, the regulation has a long list of instructions on packaging. Sorry about that. And so the package shall not resemble or imitate foods or products that are typically marketed to children or that can easily be confused with a commercially available food product that doesn't contain cannabis. If the product is an edible product, then the package must be opaque. Prior to release of a product to a distributor, all cannabis products must be packaged in its final form for sale. This again is to prevent from having any type of contamination at the distributor, because we are not licensing the distributors. The package must be child resistant and also tamper evident. And if the package contains more than one serving, the package must be resealable. Okay, so let's move on to labeling. If the cannabis product is intended for sale in the medicinal use market, then it must contain the statement for medicinal use only. The label must also contain the product ingredients, food allergens, and a nutritional panel. And the specific requirements are detailed in the regulation. The label cannot use the word candy, and the label has to include instructions for use, such as the method of consumption or application or any preparation necessary prior to use. The content cannot be attractive to children, such as no cartoons or characters or phrases that are popularly used to advertise to children. Cannot use any information that is false or misleading, or any health-related statement that is untrue or misleading. And the THC content and CBD content must be expressed in milligrams per serving or per total package. And then it must contain the warning statement, which is a very lengthy statement. That statement is in statute. So unfortunately, we are not able to make any changes to that statement. I know we have received some feedback. Some of the statement may not apply to like topicals, and we totally understand that. But this, word for word, this statement was in Prop 64. So we are just not able to make any changes to it. And then, of course, it must have the universal symbol. How do you guys like that? on every package, and then the unique identifier from track and trace and the production batch number. Okay, so let me move on to some licensing information now. So we are, like I said earlier, we're open for business. We are accepting applications for temporary licenses, and we have actually started, we're about ready to issue temporary licenses. All temporary licenses are good for 120 days. They are effective January 1st. And we do need a copy of some local permit or local authorization. And then what we must also do is we have to verify with your local authorization that you are authorized to do commercial cannabis operations in that jurisdiction. And the best part, there is no fee for the temporary license. So annual licenses, those are valid for 1 year. And the same website that I'm going to give you later on, that's where you find the link, because we have created an online application process. It's an online system. So it's going to be really easy. You create your account, answer all the questions, upload all the information that we're asking, and then you submit it to us. Let's see. A business that has been in operation prior to September 1st, 2016 under the Compassionate Use Act, we do ask that question on our online system, and those applications will receive priority review. And then applicants must be in compliance with city or county ordinances. So the statute is, reads a little differently for the annual licenses. So what we have outlined in the regulations is the process that we're going to use to verify that compliance. So once we receive an application, we are going to contact the city or the county that the applicant is in. If we do not receive a copy of a local authorization with the application, it's one of the optional uploads that you can do, then the local jurisdiction has up to 60 days to get back to us and verify that, yes, that you are compliant with all the local laws and that we can move forward and issue you an annual license. But if you give us a copy of your local authorization, then when we reach out to them, they only have 10 days to respond to us. So even though it's a voluntarily upload, we would encourage you to do so.
Yes.
Okay. So annual license requirements, this is all the same information for the licensing entities. So you have a business license, the seller's permit, the federal ID number, and then of course we're going to verify that you are in compliance with your city or county ordinances. So who is an owner? And the way that we have set up our online system is not only the main applicant has to log on and create an account, but all people who meet the definition of owner, they will also have to create an account because we need to collect their socials, the background check information. So every one of those will have to create a separate account that is their own account. They only provide and complete the individual information, and then that's where they stop. And then the main applicant is able to associate all those owners. So an owner is somebody with at least 20% ownership or more, a chief executive officer. If it's a nonprofit entity, it's each member of the board of directors. Any individual that will be participating in the direction, control, or management of the licensed commercial cannabis business. And what we mean by this is really a high-level person. This is not like your shift supervisor or your line supervisor. Also, if it's a partnership, then each partner is an owner. And if it's a limited liability company, then each member. And then each officer or director of a commercial cannabis business that is organized as a corporation. And all, like I said, all owners must create their own individual accounts, and they have to submit fingerprints to the Department of Justice. So if you don't meet the ownership definition, then there is a financial interest holder definition. So who qualifies as a financial interest owner? Well, somebody with less than 20% ownership, they will be listed on the financial interest holder disclosure list. Somebody who made an investment into the business, a loan that's provided to the business, or any other equity interest in a commercial cannabis business. And this must be disclosed with the application. So who is not required to be listed on the application as a financial interest holder? So the list is like a bank or a financial institution that provides a loan, a diversified mutual fund, a blind trust, or similar instrument, a security interest, lien, or encumbrance, and somebody who owns shares of stock that are less than 5% of the total share in a publicly traded company. So if whoever meets this criteria, then those do not need to be included in a financial interest form, disclosure form. So licensing information, these are all the documents that we are going to ask applicants to upload to our online system. And like I said, the local authorization is optional, but we highly encourage it. If you're leasing your property, we need the property owner authorization, just any kind of a letter, or the property is being managed by someone from the property management. If you're doing closed loop system, then we need the closed loop system certification, the surety bond, then a list of the types of products that you will be manufacturing, packaging, and labeling, and then a description or the actual standard operating procedures for inventory control. So this is for tracking all cannabis product at the licensed premises. The quality control procedures, this is to ensure and protect the integrity of the product through the manufacturing process and prevent contamination. The transportation process, security procedures to prevent access to the manufacturing premises by an unauthorized personnel, protect the physical safety of employees, and also to prevent against theft or loss of the cannabis product, and then the waste disposal procedures for the premises. And there's more details in the regulations on every one of these requirements. And then we also need a diagram of your premises. So our licensing fees, so when you submit the annual application, like I said before, the temporaries are free. There's no fee for that. When you log on to the system and when you have everything ready and you submit your annual application, at the time of submission, there is a $1,000 fee that is payable. And you'll be able to select different payment methods. And one of those payment methods will be cash. If you do select cash, you will get a receipt with instructions on where you will go and what facility we have available and how you can make an appointment. All cash payments will be done by appointment. And so you'll receive those instructions and bring that receipt in, and then we'll collect your cash, and then we can move forward and start reviewing your application. Once we review your application, and then of course all the individuals that qualify as owners, once the background check is all completed, then and once we approve your application, that's when your annual licensing fee is due. And as you can see from this slide, it's based on gross annual revenue. And we actually selected that metric, again, from having those conversations with the stakeholders. And the lowest fee, annual licensing fee, is $2,000, and the highest annual licensing fee is $75,000. And the reason for our fees is because we have to recoup, the revenue has to cover all of our expenses. We as a department do not receive any of the tax revenue. Okay, and so we're almost there. Next to the last slide, transition period. I want to touch a little bit on this because we are allowing a transition period from January through July for the first 6 months. In the transition period that we have outlined in our regulations, it's really for manufacturers. There's a little bit of a different transition period if product is already at retail on January 1. So, kind of move it. If product is a retail on January 1, you have to follow the transition period. That's at the Bureau. But if product is if the manufacturer has product on January 1 and it hasn't been moved yet, then that product has to meet the child-resistant packaging requirement. So if the main package is not child-resistant, you can add a secondary package and make that, and that will be your child-resistant packaging. It must also have the government warning statement, and then the amount of THC and CBD per serving per package, and you can just put stickers on that. And then all products on January 1 must meet the THC limits that we put out in our regulations. Okay. So manufacturers are the first ones that are going to start with the new THC requirements, and then they eventually will move that into the supply chain. But the Bureau is allowing a transition period for distributors and retailers so they can sell everything that's currently in the supply chain. Okay. The other thing for the transition period is you can do business with an A or an M. After the transition period, if you want to buy product, let's say for your adult market, you can only buy it from a cultivator that's licensed adult use. But for the transition period, because there is no adult use cultivation yet, the manufacturers can actually purchase product from a cultivator that's licensed M. And that will happen for the first 6 months. Okay. Okay, and so lastly, this is where I have our website. So our website is cdph.ca.gov MCSB. Our email address, if you have any questions, is mcsb@cdph.ca.gov. And then there's that cannabis portal, and that is where all the information from all the different licensing entities, and then the taxing agencies, and there's lots of other agencies involved besides just the 3 of us. You can find that information at the cannabis.ca.gov, and then it will redirect you to the different department websites. So that concludes my presentation, Lindsay.
Thank you so much. That was a ton of information. So for those of you who maybe joined us a little bit late, we are going to have this webinar available on the CCIA website, so you can come back and review it if you'd like to brush up on any of the topics that Miren chatted about. Also, too, when we had our panel at the Emerald Cup this past weekend, there was a lot of requests for these PowerPoint presentations to be available on the website. So I know that the different agencies are moving forward on that. So we'll continue to work to get you all this information. We have a ton of questions, as anticipated.
I thought I was so clear.
I know. For those questions that we're not able to get through on this, we will make sure that the department has all the questions along with the email of the person who submitted the question, so they can follow up if we don't answer all of your questions. But we're going to do our best to get through it all.
Yes, please.
Okay, good. Yeah, and we really do appreciate everyone's participation, so continue to send in those questions. So again, this was submitted earlier, but we'd love to just review the transactions between medical and adult, the 6-month transition. Can we restate that?
Sure.
Yes.
Sure. So for the first 6 months, manufacturers will be able to purchase and to sell to another licensee regardless of the A or the M classification.
Okay.
So from January until July, I think one of the examples I use, if you're a manufacturer and you want to make product for the adult use market, so you need raw material, but nobody has been cultivating for the adult use, you will be able to purchase from a cultivator with an M license that probably has been cultivating under the Compassionate Use Act right now. Okay. And then you'll be able to buy it from them. And then you'll be able to also, if in your area, distributor, which I'm not exactly sure because the Bureau is licensing the distributors, I can't imagine a distributor would only keep an A or an M only designation, but they might. But for the first 6 months, you'll be able to use a distributor regardless of the category of license. And I think the retailers are the same way.
Okay.
Yeah. So.
Great. Thank you for the clarification. If your city or municipality has not yet passed regulation, but say they move forward with that in January or February, should they still apply for a temporary license?
Yes, so temporary license is not just for right now. The statute actually gives us authority to issue temporary licenses for all of calendar year 2018. So after 2018, that's when that requirement or that authority sunsets. So if I know many of the localities are trying to pass their ordinances. Some of them probably waited to see what our final regulations look like, which we definitely understand that. So your locality is not ready until January, February, or March. At the point that your locality is ready, you can then come in with a temporary, and that gives you 120 days to put the rest of your application together.
Okay, and from what we've learning that the application for the annual is going to be more rigorous than the application for the temporary.
Oh, yes.
Okay.
So the application for temporary, the form, it's on our website. So it's on the cdph.ca.gov/MCSV. And it's a one-page fillable form. It's very easy. The annual application is much more complicated, plus you also have to associate your owners, and there is the background check.
Yep. Okay.
So definitely encourage everybody to do temporaries at any point in time. I do want to mention with the temporaries, so when you get a temporary, you do receive 120 days. And then before the 120 days are up, you do have to submit your annual application to us.
Okay.
And if you submit your annual application to us, then we can extend your temporary for 90-day periods while we are reviewing your application and getting the background checks completed. So once you get a temporary, if you go past 120 days, then you don't have a license anymore. Okay. Because you haven't submitted your annual. That's the one caveat. You have to submit your annual within 120 days. And please don't wait until 119 days.
No.
Otherwise, everybody with a January 1 start date.
I know, it's all going to go on the same day.
All on the same day.
Okay, thank you for that information. All right, so under the emergency regulations, can manufacturers also manufacture in the same facility non-cannabis products?
Can you define non-cannabis products? So here's where we're going with this.
Maybe hemp products was one of the items that they used.
So I don't know about hemp. I'll have to get back to you on that one. There is, in the regulations, we did include language that says that you could only do cannabis products at the facility. Okay. And what we meant by that is for those current food processors. So what we did not want to happen is if you are, let's say, processing, I don't know, a chocolate for the regular market, and then next to that, or even on the same line, you know, tomorrow you're running the chocolate recipe, but not with cannabis. That's what we are not allowing. Then what we didn't realize, and what has come up recently, which really made us think that we're going to have to clarify a little bit more in our permanent package, is some businesses told us, well, they also manufacture the little vaping cartridge or something on that side. So that's kind of like, to us, that was all thinking it was all cannabis related. And what really meant is something that is not cannabis and is not supposed to have cannabis, you cannot do that in that facility.
Okay. So. Great. Would ghee be considered a final dairy product?
I don't know. I'm going to have to check with our folks. Yeah.
Okay.
Let me try to get that question with our folks at Food and Ag, because it's really a so you have to look in the statute, and the no dairy, it's a prohibition in the statute.
Okay.
It's in the statute, and it references a very specific section in the Food and Ag Code.
Okay.
So that's why we are allowing butter to be infused, but you have to purchase the butter from somebody who's licensed from Food and Ag.
Yes, gotcha. And this is clarified butter, so.
So it's then probably, yeah. I mean, I will double check, but
Okay.
I'm assuming that you would have to also purchase that from a manufacturer that is licensed by Food and Ag, and then you can infuse it with cannabis at your own facility.
Great. So are topicals, do topicals need to be in the child-proof packaging as well?
Yes.
Okay.
Everything needs to be in child-proof packaging.
Gotcha. And that's starting January
1.
1st. Okay,
yes.
Great. Okay, let's see. I got a lot of the topical ones. Another one that we've had quite a bit of during this webinar and the webinar before is pet food products with THC or CBD. Can you clarify a little bit on what's going to be permitted under the emergency regulations?
Well, so we're kind of silent in the regs, but I have to refer to the statute, and I'll have to check on this, but at this point I believe that the statute does not allow products to be labeled for pets.
Okay.
That's my understanding, but I will double check on that. But it would really, yeah, the regs are kind of silent on it, but everything in the regulations is geared towards a product that's to be consumed by humans.
Yes, we've had a lot of the pet questions come in.
I know. And we don't have a veterinarian in our staff.
Well, we can work on it, right? That's what the formal rulemaking process is for us to give input on that piece of it. There's been a lot of questions on labeling. So does the labeling have to be visible at all times? Can it be covered up by other packaging? So I'm guessing that if they had a label on a candy bar and then they had like a subsequent packaging around that, would that be allowed?
Let me see. So, well, the one thing that has to be clear on the label is the symbol.
Okay.
The symbol. I'm not sure.
She's actually looking into the emergency regulations right now. That was a good question.
There's some requirements as far as font size. So I would say
font size we've gotten a number of questions on as well. That's a pretty hard one.
Yeah, so if you look at okay, so the labeling begins in Article 2, which is Section 4403.
Okay.
So it really details, there's a primary panel, and the primary panel, it's in a type size no less than 6-point font in relation to the size of the container and the identity of the product in the test site, reasonably related to be most prominent printed on the panel, the symbol, the weight, the THC, and then you could do an additional panel. And so I'm not sure if that additional panel can be, because the additional panel also has the government warning. So what we are doing right now, because these are really good questions, we are creating FAQs.
Great.
That we're going to post on our website.
Okay.
And so I encourage everybody to come in and check our website on a regular basis. So we will try to clarify more, because I think one of the areas is there is very specific labeling requirements in the statute, and that's where most of these come from. And it does have to be prominent for the consumer. So, and I totally understand that sometimes the product is small. That's why, like in the drug world, and this is probably the best connection is to when you go buy prescription drugs. The package is bigger, even though the product in it's small. The reason for that is really because of all that labeling requirement that has to be on the outside packaging. So we will try to be a little bit more clear on this area.
Okay.
But please read the regulations as well. And what we're trying to strive for is to make sure that there is enough and important information for the consumer to be able to read it clearly.
Okay. Great. And will labels be sufficient during the transition period, or do they need to be pre-printed on the packaging? So like a label that would adhere to a product that's already
like a sticker kind of a thing.
Okay.
Yeah, for the transition period, that's fine.
Great. So for a manufacturer who makes chocolate, drinks, and baked goods, will you be requiring the kitchens to be equipped with grease traps? That's a very specific question.
if it's one of the requirements of good manufacturing practices for the product, then I would say yes.
Okay.
So, you're going to give me a list of all these questions.
I'm going to send them to you with all of the emails of the people that sent them to us, so they can hopefully reach out.
Yeah, this tells me that we definitely want to do some clarifying in our FAQs.
Yes, we're getting a lot of really detailed questions, so thank you for everyone who's submitting them. I know that your department will do your best to get this information out. So if a product needs to be resealable after, say, one dosage is taken out, does that resealing need to be child-proof?
Yes.
Okay, and so can you give a couple examples of what that might look like?
Like a Tylenol bottle.
Okay.
You open it up, you take 2 tablets, and you reseal it, and it's always child-proof.
Okay, and so
something like that.
If you had like a sealable package, would that
that would
be
work too.
Okay?
Yeah. If the outside packaging is one of those, like a Ziploc, but it's child resistant, and there is a requirement that child resistant has to meet the federal standards. So that reference is in the regulations. But yeah, a Ziploc bag, as long as it meets those federal standards, that would work as well.
Okay. Great. So we're getting some questions again about edibles that do not meet the THC standards that are on the store shelves starting January 1.
As long as it's on the store shelf, then the product then falls under the authority of the Bureau.
Okay.
And I believe the Bureau, did Lori talk about this in her presentation earlier?
Yes, a bit. Yeah. And we did send her the questions as well from hers because there were some that were specific to this issue.
Right. So I believe the Bureau's, you have to read the Bureau's regs.
Okay.
Because there is, for the edibles, the product does need to meet, even if it's on the shelf, does need to meet the 10 milligrams per serving. The reason for that is because that's in statute.
Okay.
So it's not something that we could waive through regulations.
Yep.
But really, please refer to the transition period language in the Bureau for anything that's a distributor or retailer on January 1.
Okay.
Because our regulations are only addressing what's at manufacturer on January 1.
Okay.
Which we're hoping is very little.
Yeah.
That's
so
my hint.
Track and trace requirements by the BCC say that reporting must be completed by midnight the day of the transaction, but the CDFA and the CDPH give 24 hours for that to be, and we talked a little bit about this with the reconciliation. Can you touch on that, please?
Yes, I can definitely touch on that. So what's really meant by that is once a day, and we're not delineating, do you do it at 5 o'clock, 6 o'clock, but it's really once a day, so within 24 hours. So I think we're kind of all saying the same thing, but just possibly using different words. Okay. Because by midnight, well, 12:01 is the next day. So within that day, even for CDPH, you have to do your reconciliation once a day.
So it should be done daily.
Yeah, it needs to be done once a day.
And if you are a consultant or an attorney who is filing on behalf of a client, you wouldn't have to identify yourself as an owner. You're able to be that kind of third party distinguished if you are sort of helping those folks with the application, if you are under that 20% threshold for an owner.
So right now, the way our system is designated is that the main applicant, the main person completing the online, needs to be an owner.
Okay.
That one main applicant must be an owner.
Okay.
Because we're asking for socials, background checks, and that's the main applicant, the main owner that is associated with that business.
Okay.
So you have to go back to the owner definition to see which one, what category they fit, and then that should be the person applying. Okay.
And if they have questions, they should get in touch.
Yeah.
Okay. Sounds great. Can we talk a little bit about the 10 milligram distinction for a single serving? For chocolate bars, are those needing to be kind of perforated or scored?
Yes.
Okay.
Yes.
And scored. And so, are there other 10 milligram distinctions that you can make with vaping or with tinctures? And do you need to make them with those two things?
So the 10 milligram requirement is for edibles, and juices count as edibles.
Okay.
We're defining them as edibles. So you'll need to somehow delineate either score or some other delineation of what each serving really is.
Okay.
That is clear for the consumer, that they know that they are only, if their intent is to take one serving or maybe half a serving, they want to start out with 5 milligrams, they can do that easily.
Okay.
For the other products, when we're doing the total package limit, if the manufacturer does want to delineate what the servings are, you can do that, but we're letting you decide how you do that.
Okay.
There is no requirement that you have to do a per serving delineation, but for the edibles there is.
Okay, gotcha. So, and if a drink is an edible, would you sort of, would a little cup on the top that has the measurement
Yeah, like
be
a
suitable?
cup or something.
Okay.
Yeah, something that, I think that's what's used in the drug world, when you take cough syrup or something like that.
Mm-hmm.
So.
Okay, great. And again, we're getting some questions just on the child-proofing thing. All cannabis products, topicals, tinctures, edibles, juices,
Yes.
all of that has to be child-proof. Okay.
All products.
Okay. In your experience so far, are local fire departments ready for these inspections that they have to do? Are they getting ready, or have you been hearing from them?
We have had contact with CAL FIRE, the state agency. We also have had contact from some locals. So our understanding at this point is that they are getting ready for this.
Okay.
I think CAL FIRE has done guidance for the local fire departments. I think that's what they're called. I mean, if anybody has any specific questions on that, they can send to us. But my understanding is that they are ready for this. They know this is coming. And this really is a safety requirement for us when it comes to the extraction processes.
Okay.
That's why we are requiring it for the extraction processes.
Great. One other question that we've received about what exactly you're looking for in the floor plans for these manufacturing facilities, if that's something that you can rattle off now or share in the frequently asked questions.
A simple diagram.
Okay.
So, detail your building, and is your entire building manufacturing, or is manufacturing done in one room? And are you doing indoor? If you're doing indoor cultivation, then of course that's a separate room. So that wouldn't be considered your premise for manufacturing. So we just kind of want to know, what does your building look like, and what do you designate as your manufacturing premise?
Okay.
One of the reasons for that is when you read some of the good manufacturing practices, we want to make sure that what you have designated as manufacturing meets those standards. The floors, the walls, those have to be made of material that you can clean, that you can sterilize. So you don't want to be running a line in the middle and having plants growing right next to it. That's not a sanitary condition.
Okay.
So that's what we're looking for. We're looking for a diagram that you can show to us. This is what my building is. This is my manufacturing premises. These are hard walls. This is how I meet all of these good manufacturing practices and sanitary conditions to be able to make this product.
Okay. Great. And as we wrap up here, I would love for you to talk about any educational or outreach efforts that you all are doing over the next couple months, so people can plug into that and come and check you out.
We have been doing the licensing workshops. I think yesterday was San Francisco. I think Monday was Oakland. Next week is LA, and I believe Riverside. So if you are in one of those areas where we have not visited yet, and you can get the schedule on our website, please. It's a lengthy presentation. It's even more than this. They will show you certain screenshots of our online licensing system, so you can see what it looks like, what are the requirements that we're asking for. And we are doing, so we do 2 workshops in the same location. So we're there for a full day, and it's from 9 to 12 in the morning, and then 1 to 3 in the afternoon. So two workshops, same location, one day. The schedule is on our website. I should have brought a copy of it. In addition to that, like I said, FAQs on our website. Please sign up for our listserv. If you have any questions, the email address is there. And then just note that we will be going out with another emergency rec package soon. And then in addition to that, when we release the permanent regulations for public comment, the public will have 45 days to give us more comments.
Great. Well, we certainly look forward to that. Thank you so much for all this really helpful information. We hope that all of you enjoyed this webinar. For all the questions that we were not able to answer, we are going to submit all of those over to your agency so you can see, and that includes the email addresses, so if you want to reach out to folks directly. But this has been a really awesome opportunity for us to learn more from your department. Thank you so much for taking the time to come over. Again, thank you to 9 Point Strategies for helping us put together these awesome webinars. Yay! This is a new thing for CCIA, so we're really excited that we're actually able to pull this off. Thanks again to the staff here at CCIA, Josh Drayton and Justin McCarthy, who helped to do a lot of the outreach and helped get all of this together. Yeah, so keep in touch, everyone, and we're following this up with one more webinar, final webinar of the day, with the Department of Food and Agriculture to talk about Cal Cannabis and cultivation. So that will start right at 3:30.
All right. Well, thank you for having us, Lindsay.
Absolutely.
This was a great opportunity for us to try to get the word out.
Yes, indeed. Keep in touch, everyone. Thanks so much for joining us.